Good evening or afternoon, not yet. My name is Corina Herrera Loera, Public Information Officer for the Santa Clara County uh, Emergency Operations Center. Thank you so much for joining us here today. We do have our conversation with Dr. Solorio Cortes, and he will be available for questions and answers. But before we do that, we're going to go ahead and begin with our update for today. We have Gloria helping us. Thank you so much, Gloria. Next slide, please. So, as we all know, we have hit the metric here in Santa Clara County. And as of today, as Dr. Sarah Cody announced yesterday, we are lifting the mask mandate for any indoor public locations, regardless of the vaccination status. However, it is still highly recommended for various reasons, and I'm sure our doctor will maybe talk a little bit about that, but especially in communities where COVID still continues to hit in high numbers. Here you can see the different metrics that we covered that we were all waiting for to ensure that our county can lift that mask mandate, and we're there. Congratulations. Over 84% of our county is vaccinated. Our numbers have remained low in a 7-day average. Our numbers in the hospitals continue to be low. And so we're just hoping that our trend continues, and that, we can just continue moving forward in this way, to the point where it's no longer highly recommended, and that we can all just live without our face masks. Today I work in the county office, and even still working with it, right? It's like I can't wait to not have to work with it on when we're in our office space as well. So yes, congratulations to all of us. We're at a great place in Santa Clara County, and we get to move forward. Next slide, please. And so here is the three different points that we wanted to focus on. As we know, the mask mandate has been lifted. And then the second point is schools. I know a lot of us as parents are wondering, is my kid going to have to wait, or going to have to wear it for much longer? So in the state of California, which is what the county is aligning with, after March 11th, they are lifting the mask mandate. However, it will be left onto every district to make that decision. So know that, just because the state lifted and the county lifted, the district might have a different guidance. So, make sure to check with your district, with your teachers, to see what the district will be doing, whichever it is that your child goes to. And then in regards to mask requirements, as we've heard and as we know, there's still going to be locations where it is still required. I mentioned the county office, but places like different medical locations, long-term placements, jails. There will still be locations where the mask is still going to be required. But at this point, at least for myself, it's always making sure that we're keeping ourselves safe, and keeping others safe. So it will be by choice, outside of those locations where the mask is not required. But there will still be locations that, if you think, I'm just going to walk in here without my mask, and you might be asked to put it on, and may be one of those locations where the mask is still required. So just being aware of those places. Next slide, please. And here we see, just a reminder, as of the 7th of February, we updated our health order so that we should go to our health care providers, so wherever we have our medical insurance with, to get our tests if we have any symptoms, ensuring that we get them. So whether it's Kaiser, whether it's El Camino, these different providers, ensuring that we make our appointments with our providers to get tested. Now, next slide, please. If you are not given an appointment or not, given a time to get your test, if they are preventing you in any way, shape, or form, there's places to make any reports of any concerns. So the phone number is there, the 961-5500. And then also on the right, you see on the flyer, there's a QR code. I'm going to leave it for a few seconds. I'm pretty sure if you can put your phone on there and it'll pop up a link where you can click, and you can also make any reports of any concerns if you have different providers that are not following this. Next slide, please. And in regards to the vaccinations, they're still being provided. As I mentioned, there's a little over 84%. We might be closer to the 85% now, but that still leaves a big number in our communities that are not vaccinated yet. So there's still locations where you can go, whether it's your first dose, second dose, or your booster shot. And so you can access these dates and times and locations on our website, SEC, the dashboard, Santa Clara County dashboard for COVID-19. And we update this schedule on a weekly basis. And so these are the locations for this week. And again, you can call our numbers 211. You can go to secfreevax.org to make your appointment. And there are some drop-in vaccination clinics that you can go to and drop in if you don't have an appointment. Next slide, please. And for those of you that live in the Story Road area, Story and King, we have the Story Road Hub Services Center there. There will be COVID-19 testing and resource support with resources around COVID-19. These are the dates that there'll be staff there available to support. Feel free to go there. Again, this is one of the several locations throughout the county. Call 211 for any resources that you might need. But this is a site here on the east side of San Jose at Story Road where you can access the resources and services there in person. So if you choose, if you don't want to make appointments, you don't want to make phone calls, and you want to go straight there, feel free to go there. It really depends on the day and the lines and who's there and if you'll get serviced. I know for me, I'd rather have an appointment and know that I'll be serviced and I won't be standing in the line. But if you rather just, go straight there, you're able to do that as well. Next slide, please. And so we're still not in the clear, right? So just because our numbers are looking great, just because, we've lifted the mask mandates, it doesn't mean that our community is still not being affected by COVID-19. We all are still hearing about positive COVID tests. And so continue to monitor yourself for symptoms, any of these symptoms. I think by now we've memorized them, right? But any of these symptoms that you see on our screen, and then also our children. If, your child is feeling sick, before it was just that fever, right? That would get us as parents to check them or continue to monitor their fever. But now any of these symptoms, make sure that you have an antigen test available. If you don't, most likely your school will have it available. So if your child has these symptoms and maybe you don't have a COVID test, don't just send them to school. Let your front office know. And, I know most schools might have them available where they can take the test before going into school. We are trying to prevent, another surge. And so as we all continue to be aware and diligent about checking ourselves, our children, our families, we'll be able to continue to keep our numbers low, and get to a point where then this will be a thing of the past. But for now, it's still not. Next slide, please. And, again, if you have symptoms, make sure to test, and if you test and it turns out positive, then what, right? What do you do? There's still the guidance for the quarantine We have it online. You can go to this site, the seccstayhome.org. You can go to SEC, like I mentioned, if you just remember the dashboard, do a Google search on Santa Clara County COVID 19, and you will find the guidance, and it's in various languages. But, is it a 5 day? Is it a 10 day? When is it a 5 day? Can you get out after the fifth day, or do you have to wait the entire 10 days? And it really does depend on each case and where you're at. Uh, and if anything, make sure to keep a stash of the antigen test, at least one, right? Because you never know when you might need it, whether it's to know if you have it or to know if you're able to come out of the quarantine. So hopefully, I know the county has gone to different doors throughout the county to pass out these tests. Hopefully, we still have them available, even if it's that one. And you know that your service providers are able to also assist you if needed. And if not, of course, here we are as a county to help support, especially those that might not have medical insurance that might need to access some of these resources still. Next slide, please. And so again, like I like to always highlight different phone numbers, different resources. I'm gonna just mention a few from here. Know your rights in the workplace. I know some of us may still be having issues with our workplace. If we have to quarantine, can we? Can we get paid or not? And if there's issues, you can call that number, the 1-866-870-7725. Mental health services, we're almost hitting that 2 year mark, and it's really hard, and we've gone through tough times. And to hear like we're still not out, and our children, and some of us, when we might get, COVID 19 and we have to be isolated. All those things do have an effect on mental health, on all of us. And so we have our resource line, which is 1-800-704-0900. And then, like I mentioned, the 211 number. If you just have a general question, you can call there and then they'll guide you to the right department. So if you remember anything, remember 211. That's the easiest number. You could always call them and then ask them to guide you to the right department. And then the crisis hotline, which is 24 hours a day, 7 days a week, at the 1-855 278-4204, or you can text renew to 741-741. I know some youth might prefer to text, and so that option is there as well. Next slide, please. Okay, thank you so much, Gloria. And now we're going to bring in Dr. Solorio Cortes. Hi, Doctor. Welcome to our community forum again. Thank you for being available to provide updates and be available for any questions that our community might have in relations to what we are discussing today, which is good news. Good news, right? We have Dr. Solorio Cortes, Gerardo Solorio Cortes, and he works with our Santa Clara County, our Valley Medical Center, and has been serving the community out in Gilroy, assisting patients out there, and really just across the county, assisting patients throughout, answering questions through radio shows, through our community forums, to different presentations. So thank you so much, Doctor. And do you have any updates for us? Go ahead, Doctor. Welcome. Can you hear me? Yes. Okay. So if you have any updates for us, and then we'll open it up for any questions.
Yes, I can. Sorry, there's some delay.
I think we'll go ahead and go, and maybe I don't hear a delay, but I don't know if the audience is hearing the delay. I'm gonna go ahead and mute myself so that I can unmute you, and then hopefully that helps. Doctor, can you hear me? Uh oh, I don't know if it's your internet or my internet. Let's see. Can you hear me,
Great.
doctor?
Thank you again, Karina. Sorry about that. I believe there's some technical difficulties, but we can work through this. Again, I am Dr. Solorio. As Karina mentioned, I'm a primary care doctor here at Valley Health Center in uh, Gilroy. Um, so basically, I just want to just reiterate what Karina has beautifully mentioned on the presentation. I think the biggest point is the fact that, because of the science, because of the numbers, um, because of the vaccinations, because we got therapies for COVID-19 now versus, a few months ago, we're able to say that the masks are, it's not a mandate, but they're recommended. And in some individuals, and I think we're moving towards, what at the same time we want to do what's best for the whole community, of course, and this is what the mandates, the vaccines, for example, are all about. But at the same time, as we move forward, um, we're gonna live with COVID, and each individual is gonna uh, accept or not accept what they're comfortable with. So, for example, I mean, although we're saying that, the masks, there's no mandate to those, they are recommended. And in some individuals, for example, those that are unfortunately, going through cancer and receiving chemotherapy, um, getting the vaccine for them, even getting the third or even in some cases the fourth, booster in those individuals, they may not mount a good response to the vaccine and be protected against COVID as we move forward. So for those individuals, for example, it's going to be, a good idea if you were to talk to those individuals, they would want to wear it no matter what, we recommend until things are a lot better. So I think what I just want to say is that each individual is gonna make their choice, and in certain situations they still may use the mask, and that again that is a recommendation as well. That's number one. Number two, as we've seen through our studies, through our people that get severe COVID, or community members that end up in the hospital, we know hands down that being vaccinated helps you against severe um, disease. We're very happy at our vaccination rate, the percentages. I mean, that was one of the metrics that helped us lift the mask mandate. But there are still individuals, as Karina mentioned, there's thousands of people, even though it's the 80% that's been vaccinated, that translates to thousands of people still who need to start their series, and also it's even a higher number that have not received their booster. And studies recently have looked at people that gotten their series vaccine but not their booster, and those that are not boosted do end up with more severe disease. So very important that one of our layers of protection, important one is going to be the vaccines. And while we talk about vaccines, I do want to mention that in the previous forum, we talked about how the FDA and the CDC was having conversations about approving the vaccine for 6 months and 6 months to 5 years old, and unfortunately, it hasn't been approved. There's still more studies being done. The biggest issue right now is if um, the two series uh, Pfizer vaccine is enough, or is there going to be a need for a third booster in this population? So more to come, and hopefully, and I believe they're looking at probably April, May to come back with the data that will show us what the series is going to be, how many vaccines is going to be for the population of 6 months to 5 years old. Um, and then lastly, we got more, medications available now. We have the monoclonal antibody treatment that it's available in the county. That's number one. Number two, we also have the oral medication, specifically Paxlovid. So for anyone who is infected, there are therapies. So reach out to your um, doctor or healthcare provider to see if you do qualify. Um, and I think that's it for me. I'm here to answer any questions that the audience may have. Thank you very much.
Thank you, doctor. And I know there was a little bit of echoing, so we're gonna practice this muting one another when we're not speaking. So I do have several people here. Thank you, audience, for joining us today. And I have some questions, and so I'm gonna go through them. And I'm back. Man, so sorry about that. And I think it just shows, right, that this internet sometimes we just gotta roll with it. Um, and I look forward to doing these things in person one day and inviting the community out. So I'm back. Sorry about that. So I'm gonna go through the questions, Doctor, to not waste more time here. And I have a lot of comments, but I'm gonna focus on the questions. Let's see. Uh, 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 uh. So we have Simon Gordon, first question here. And he's wondering, looking at the dashboard, it doesn't seem deaths have started declining yet. Can you share any data on the current profile of who's dying, given it's still at the highest level of any time in the pandemic apart from winter 2020-2021? Good question, Simon, and good point. And so what I'm going to do is I'm going to do my best to share my screen here and see if I can do both without kicking anybody off the community forum here. So let's see. Let me share my screen. And what I want to do is walk you through the dashboard where you know how to access the information. So let me minimize this, bring this up. Dr. Solorio, please let me know if you can see my screen. Are you able to see my screen? If you can, maybe you can't mute yourself. Can you see my screen, Doctor?
Yes.
Okay, perfect. So I'm going to take you to our dashboard of where you can obtain this information on a regular basis. So this page was last updated here March 1st. As you can see on the deaths, cumulative, so total, there have been a total of 2,133. But what I'm going to do is take you then to the specific cases, as Simon requested, the demographics of the cases. And here you will see a breakdown of all. Remember, this is all the deaths. And so of deaths by gender, by cases, race, ethnicity. And as you can see here, our Latino community still continues to be the highest, just like in the cases. And here it does break it down for cases occurring on or after, and that probably is May 20, 2021. Um, the different breakdowns. And so deaths here, we'll go there. I'm sorry, the ones that I went over right now were the cases, positive cases. And then you'll see that Latino continue to be higher in the cases. But on the deaths, also you can see it by age group, you can see it by gender, race, and ethnicity. So you can, this was last updated on February 25th. We do our best to update it regularly. And so you can obtain the information through our dashboard. But very good question, Simon. Anything to add, Doctor?
I would just add that with Omicron, um, that surge was more of a volume and less of a severe than, like, for example, Delta. I think that if the lethality or the severity of disease would have been as same as um, Delta, for example, we would have been in bigger trouble as it relates to hospitalizations and deaths. So when you compare it by the amount of infected, um, which is thousands compared to Delta or last year, it was a lot more. I think when in January started, we were like at daily 4,000 cases in Santa Clara County. So it was more contagious when it came down when it comes to Omicron. But hospitalizations and deaths were relative to the amount was a lot less.
Thank you. I'm going to go to the next question that I see here related. Let's see. We have comments. I see a question here from T. Villarreal Alarcon, who is wondering why are classrooms not considered high risk environments since 30 kids are in a classroom and half are not vaccinated. I don't know. Doctor, do you have any specific answer to this question?
It's an excellent question. I get it in terms of being in a room. I don't know this. I mean, I'm not a school official or looking at, but what I do understand is there is more, or at least as I think Karina has mentioned, by depending on the school district, what other layers of protection have they added to their classrooms to protect their students, and uh, are those layers adequate enough? And then lifting the masks, is that gonna be okay? I think it's more to come, and I think that's why we mentioned that it's gonna be a specific, um, based on what a school district you're in. But I totally I do understand the question. um, Studies have also been done, so I think, to add reassurance and confidence, is the school district is even individually, they going to act on what science has told them, or science has shown, to make the classrooms as safe as possible.
I agree, Doctor. And I'll just mention the district that we, are here in Alum Rock. We got a notice right away that masks were going to continue to be a mandate here. So yeah, I don't know what the state level was looking at. I don't know what they were thinking. I can't answer those questions, but like you said, I'm sure that science is going to be continued to be taken into consideration depending on the school district. And even at the end of the day, we still, our children might feel more comfortable still wearing it. Even if they don't have to in the future. Who knows? Some of us might, as adults, or might just wear it, forever. It might be a normal thing. Who knows? But for now, each district, will be taking that. Thank you, Doctor. And I'm going to the questions here. I have Kat Da Silva, who is wondering, will vaccines or proof of negative tests still be required for city funded events and concerts, and big events? So as you all know, we're a county, so I can't really speak on city funded events, but I know that I've been to several in the past, week or so, and they're still asking for them. I haven't seen any guidance regarding the proof of negative tests or vaccines, so I don't think there's any changes that have happened as of now, whether it's within the city or the county. So I think they will most likely continue, um, unless there's another announcement made. Doctor, do you have anything to add to that?
No, I don't.
Okay, we'll go here to the next question. Let's see. Okay, we have Jeremy Scott. Jeremy Scott is wondering, County of Santa Clara Public Health Department, do you have plans to remove outdated COVID-19 prepared signs from businesses? Good question, Jeremy. I don't know. I know that I haven't, my team hasn't gone that far. I don't know the answer to that. What I do know regarding businesses, so I'm glad that you asked that question because then it prompted me to remember another point of information is that in regards to the masking orders and policies, the county is there's no order that prohibits any agency from drafting their own policy within the county. So really, it will be, just like districts, it will be left up to the leadership of the different agencies and organizations. If you don't fall under the required masking locations. Um, Doctor, do you have anything to add to that?
I don't. Thank you.
Okay. Mm-hmm. Let's see. Next question. Okay. I have this one. Dr. Gerardo, if masks work, why we had COVID Omicron surge?
It's a very good question. Um, what we do know is, compared to like Delta, for example, the mutation that happened made it more contagious. Um, but even so, the science said without masks, hands down, um, you would have had a lot more cases. I mean, there's no debate in terms of like looking at individuals who have the active infection, they're have the symptoms, are coughing up the symptoms. You take that individual and another individual who's not masked, and that's going to be a higher probability that you're going to infect that individual in that place. Studies have shown it, and those studies have actually broken down with um, one individual wearing the mask, the other one not wearing it, um, um, or being in a close place with an infected individual, and then someone coming in half an hour later with a mask, without a mask. Hands down, the masks work. Why do we have a surge? Uh, Patients, I mean, people in innate mutation of the or being the variant of that particular virus, the Omicron, being more contagious. Um, just in and itself, that makes it more contagious. But for a fact that if no masks are worn, um, the potential of infectivity is higher when somebody is not masked. So the evidence has always, or the science has always said that they do decrease the amount of disease that spread. So they're very effective.
Thank you, Doctor. And then I have a next question from Rita Horiguchi. And she's wondering, when will a fourth booster be approved? She says, I'm 76 years old, got my booster immediately after they were approved. Now it's 6 months and my immunity is going down, probably a lot. What is the status of a fourth booster? Do you know, Doctor?
It's a very good question, Rita. Thank you so much. At this moment, there's no recommendation yet for a fourth booster for healthy individuals without, for example, immunocompromised condition like as such as breast cancer, for example, or going through chemotherapy. And those individuals actually a fourth dose is recommended if you look at their series. But other population at this moment, it hasn't been approved. Um, as we said before, the science is always changing. Studies are always being done. We do not know if a fourth booster is going to be needed at the 5th or 6th month. You are right that previous studies did show a waning, decrease of the protection after the two-dose series for Pfizer and Moderna, for example, and that's when the booster was recommended at 6 months. So science did tell us that. At this moment, science is not telling us that yet, that we need a fourth booster. So that's still to be determined. Furthermore, is it going to be a vaccine where it's going to be very similar to the flu shot, which we get every year because of the different type of flu that circulates yearly? That's still a work in progress. So there's more to come in terms of deciding when the next booster or vaccine will be needed.
Thank you, doctor. uh, I'm clicking the mute, unmute, next question. So now I'm going to the next question. We have Simon Gordon again, and he's wondering the demographics are for the full 2 years. I'm interested in the current split, or am I wrong? Good question, Simon. I'm not sure, if there's any right or wrong here. And maybe you're asking about the full 2 years. Yes, that is for the entire full 2 years. And what I'll do is I'll take this question, and so we can look at the data and then see if we can get updated numbers for our next community forum in regards to the current split. I don't have those numbers readily available, but I think it would be interesting to see what the current numbers tell us. Thank you for participating and being here. All right, let's see. We have next question. I think that's the last question, Doctor. We do have a couple comments here. We have Chelly Champit Jimenez, who says, I know my family and I will continue to wear our masks indoors and outdoors. Thank you for joining us, Shelly. We have Ofelia Medina. Thank you both for providing these important information sessions for the community. Thank you, Ofelia, for joining us and doing all that you do for our community. We have Rita, who says thank you. And with that, Doctor, thank you again for your time. I know that, we do our best to just give an update to our community. Sometimes we like what we hear, sometimes we don't like, and that's okay. The important thing is that we're all updated and informed of where we're at, where we're going. I feel like it was nothing but good news today. So thank you, Doctor, again for being here. Any last words you would like to add before we close?
No, again, excellent questions. Thanks again for the invitation. And again, more importantly, whoever hasn't started their series, their vaccine series, or is in need of their booster and they qualify, please get vaccinated as soon as possible, because that's what's shown us, and I mentioned a few minutes ago what we see in terms of preventing severe disease or death. So have a good afternoon and thank you very much.
Great. Thank you so much, Doctor. Hope you also have a good afternoon, and everybody else that joined us here today. Thank you, and we'll see you in 2 weeks again in our community forum here for our public health department. Have a good 2 weeks, and take care, everyone.